How are you guys? Thank you. Thank you for the invitation. Thank you. It is very exciting for me being part of this first Delta International conference for the Delta University.
You are
And
welcome.
is everything okay with my voice and my video?
Yeah, it's okay.
Okay. Excellent. So if you can share um, privileges with me. Okay. I'm going to share my screen, okay? Just want to make sure that that the screen is full. Okay. The screen okay for you guys?
Yes.
Okay. Thank you. As I was telling you, for me it's a pleasure to be here with you guys. I'm very excited because this invitation is very important for me because I have very good friends uh, and I would like to share today this topic that is called solving orthodontic cases with Invisalign. As you may know, today we have a lot of changes in orthodontics around the world. So I started with the Invisalign system almost like 5 or 6 years ago, and I didn't trust the system at that time, but now the things have changed. So I want to share with you my work and the things that we're doing here in our clinic in Mexico City. I would like to introduce me. I know that already they told you about me, but I just want to make sure that you know that in this part of the planet, we we're also doing good orthodontics as you. So I got my master's degree in Mexico City here in Universidad Intercontinental or in Intercontinental University here in Mexico. I'm an Invisalign speaker and also an Oracle key opinion leader. I also certify doctors for Invisalign system here in Latin America, and I'm also a professor of the Orthodontics Master Department at University, Intercontinental University here in Mexico City. We have a master class here in Mexico. It's an international master class, actually, and I'm the founder of this master class. We have uh, one speaker, international speaker, yearly coming here to Mexico, and we share our acknowledgement and everything about we know for aligners. So let's start. In this Delta International Conference, we have very good friend from Mexico too, Dr. Jorge Homlich, uh, Dr. Rodrigo Madrazo, who spoke for us too, and Dr. Jorge Casian, who is speaking just right after me. And for me, it's an honor being part of this group of speakers here with you guys. This is Mexico City. If you don't know Mexico City, you have to come. We are pleased to have you here. This is the Angel of Independence, which is like the most important like art or statue here in the city. This is the main avenue. It's called Reforma, and it's a beautiful, beautiful part of the city. So if you come here, please visit this part because it's very good. We also have our Mexican food, which is mainly uh, done by with chili and avocado and sauces and everything. So the specialty here is tacos. So please, if you are coming, you have to eat tacos. Remember, and this is our clinic in the city. This is our dental clinic, and we have color clinic and Invisalign Center. And why is this? Because we do a lot of aligners. Right now, our consultation is about 80% aligners and 20% braces. So it is a very important number for us, the amount of aligners that we do daily in our consultation. This is my team, and this is a great photo that I always like to share with you because for me, they are the most important part of my clinic. They are the heart of my clinic. And without them, I wouldn't do nothing. So I always try to share this photo with my lectures because I want to know that my team is compromised and have this feeling about our consultation with clear aligners. So let's see what happens with clear aligners. Why did we decided to do Invisalign system instead of braces? As I told you before, I started about 5 years ago with aligners, and in the beginning, I didn't trust the system, as I told you. But now we realize that the aligners have more control of the cases with orthodontics. So here in Mexico, it's very hard for doctors to get a new system and to adapt to a new system. So it was hard, but now we're having this change, and I think most of the orthodontists here they now do aligners, not in a big number, but they are beginning to do the aligners. So this is why I'm trying to give you today. So let's see some clinical cases. I have prepared 3 different cases for you, and I want to share these cases with you because I think it is important that you may know what we can do with this kind of system. So the first case is a class 3 with a rotated tooth about 90 degrees and anterior crossbite with also severe crowding. So let's meet Elizabeth. So Elizabeth came to my office and told me that she wanted to do orthodontics and she wanted to fix her teeth, but she didn't want to use braces. So I said, okay, let's do it. I love the aligners, and for me, it's an honor to treat you with aligners. So this is how she looks when she smiles. And you may see a lot of crowding on the lower arch, but there's something hidden inside of her mouth. So when we see her mouth, we see the crossbite, we see the class 3, we see this part edge to edge. So she's losing her teeth in the front, but she also has this compromise bicuspid by almost 90 degrees rotation. So what we can do in this kind of cases, of course we can use aligners, but remember that a big rotation maybe can be difficult for just rotating all the tooth, and it may take a lot of time. So what we decided to do is like a hybrid model. So I'm going to show you. This is her panel, and we can see that she has this molar here impacted. So we spoke with her. She told us that she wanted to do this fast, And I told her that maybe it could take time to take this more out. So we decided to focus just on the tooth that were in the outside. And just right after we finished the treatment, we were going to pull this out. So look at the inclination of the incisors. We have a lot of inclination. We have proclination of the upper and lower incisors. So in this case, we have to do a lot of things just not to proclaim more these teeth. And we have to control with the aligners. So let's take a look at what we did. We did a hybrid model when we were doing a couple here with a pair of buttons and just a small wire here, sectional wire, so we can derotate this premolar. But at the same time, we are using aligners to move everything on the upper and on the lower. So as you may see here, at 4 or 5 months of treatment, we are derotating this bicuspid, but in the same time, she is moving the rest of the teeth. So this is the way that we work the clean check. And as you may see, it is only taking us about 19 aligners to correct this first step. And I told her that this first step is not like a part of the real treatment. And why is this? Because I asked her just to think about this first phase as just moving as much as we can while we are derotating the bicuspid. So this is the way it looks. The clean check looks like this because we have cut this part. So we can control the rest and we can derotate the bicuspid at the same time. So don't worry if you don't see nothing here because we are moving, but with braces in this part, okay? This is like a hybrid model. But remember, at the same time, we are correcting the crowding at the lower arches. And as you may see, we do a thing that is called round trip. And what is round trip? Remember that sometimes we cannot do the IPR just right at the beginning of the treatment. And why is this? Because we can compromise the enamel of the tooth. So we ask the technicians to move the teeth forward, and then when we don't have any crowding, we can do the IPR, and we are not going to compromise the enamel of the tooth. So we're working at the same time, two different things, okay? So this is what we got after the first set of aligners. So as you may see, I was expecting this because this wasn't part of the aligners, but the rest, it's quite good. We have corrected almost the crossbite. We have corrected the crowding on the lower and crowding on the upper, and we are ready to start now the second phase, which is going to be way faster. If we had decided to move this bicuspid with just aligners, it would have taken us maybe like 6 or 7 more months, okay? So we are going to start the second phase, and in this second phase, we're going to intrude this bicuspid, and at the same time, we're going to put everything in the correct position. We're using elastics, class 3 elastics on the right side, and a delta elastics on the left side, so we can control this bite, and we can correct the midlines and everything that we want to correct. So this is the way it looks. And look how we are correcting with a class 3 elastic here, while we are extruding on the rest of the teeth. And here we're using a delta elastic just to make sure that we can fit the occlusion on that side. Okay? So let's go. In this part, we can see that we have corrected almost the bit lines, and we have to correct it. I'm sorry, I think someone was speaking. We have corrected the class 3
Yeah,
here on the right side.
I'm
Okay?
mute.
And
I'm
this is
muted,
not
doctor.
still finished. What we're going to do is to finish this part because the case is not still finished. So if you agree with me, let's do another one phase just to correct. But let's see what we have here from here to here. Okay? So let's do another last phase just to correct the last part of the treatment. But in this part, we have to finish because it has been like a lot of time since we began the treatment. So here's how we are correcting again with the attachments on the back. And after we finish this part, we finish like this. This treatment took us around 18 months. We were changing the aligners every 7 days, and we have corrected all the things that we wanted in the case. So remember the class 3 here. We have corrected the class 3. We have corrected the anterior crossbite, the 90 degrees derotated the bicuspid, also the crowding in the back, and the class 1 here in the right in the left side. So this is the results at the end. This is the smile that we got after 18 months and 67 liners. So this is the way she looks just right after we finish the treatment. Just have to compare the beginning and the end. Remember, 18 months. We've been changing the aligners every 7 days. This is very important. Our protocol is change the aligners weekly, but with vibrations. So we use a device which is like Accelerant to change the aligners weekly, even in difficult cases like this one. Okay, so this is the finish. So remember, we spoke about the second molar and at the back, and we decided to, she decided to extract the molar at the end of the treatment. So for me, it was very easy to do that because she told me, doctor, I want to remove this one and I don't want to put this one because I'm okay with treatment and I will think later what I can do. But for now, I decided to remove it. I told her, please don't remove it. Let's go for it. Okay. So this is the beginning and the end. And let me show you how we have corrected the pro inclination. But remember, she used to have a lot of crowding. But with this kind of crowding, if we put braces on, we're going to procline those teeth. But with the liners, we have control, and even we can retrocline them slightly, as we may see here in the X-ray comparison. So beginning and end after 18 months. Let's see the difference. There's a huge difference, a big difference. No restorations, just enamelplasty here in this part, because we have extruded the upper incisors. And look at the change in the profile. It's a good change for the profile, the beginning and the end. And the pro-inclination of the tooth, it's better. Okay, let's go with the second case. This second case is another class 3, but in this case, we have mandibular deviation. And this is the kind of case that I will like to ask you, what would you do? Because for me, this is a surgical case. And let me show you why. This case, as you may see, she doesn't have a lot of protrusion of the lower jaw, but when we are and we see the inside, we're going to take a look of the almost 4 millimeters class 3 here. And we have a full class 3 here and also a crossbite with edge-to-edge bite on the front and a crossbite on the back in the left side. And just right in the right side, we also have a class 3. Not a full class 3 like in the left side, but for me, this is a very hard case to do even with braces. But remember, we're using aligners for treating these cases, and patients always ask us to do the cases with liners. So for me, this was a very good case to treat, and we decided to do it without braces and just aligners, okay? So how are we going to move this 4 millimeter class 3? This is a lot of lower distalization because we cannot do mesialization of the upper jaw because she didn't want to do surgery. So also she didn't want to extract a bicuspid. So we spoke with her and we told her that we needed to do at least extraction of the wisdom tooth and the lower so we can distalize the molars. And that's what we did. We extracted the eights on the lower arch and we decided to distalize. And how do we distalize with liners? This is called sequential distalization. So take a look at this. The eights, they have to go for the treatment. So she just decided to remove the lower ones to begin the treatment because I told her that if she didn't remove the lower molars, we wouldn't be able to do the treatment with success. So this is a class 3, and for me this is a surgical class 3. But we decided not to do this surgical and just with aligners and elastics. So let's take a look on what happens on the clean check because we're retracting and we're extruding the upper incisor and we're retracting the lower incisors. So how do we do this? I want you to take a look at this part. This is called sequential distalization. And this sequential distalization is very important for us because this is the only way that we have to correct sagittally a case. So let's take a look how much we have to distalize. And this is about 3 or 4 millimeters for distalization. And this is the way it works. We remove the eights and we move everything backwards, backwards and backwards and backwards. So we can get this class 1 at the end of the treatment. So this is what we got after we finish the first part of the treatment. Remember that in our clinic, we always try to correct difficult cases in at least 2 phases of the treatment because the first phase, it's almost never enough to complete that case. So we're going to do a second phase. And in this second phase, we're going to move everything backwards like this. Again, slightly distalization. And after this slightly distalization, we're done. Okay. So this is the final result of the treatment, just right after 17 months and another 67 aligners. It's the same amount of the other patient, I think. But we are 17 months of treatment with this girl. This is the way she looks at the end of the treatment. Look at the smile. We have corrected the crossbite here, and she doesn't look like a class 3 anymore. Beginning and final. And we, as you may see, we have corrected the class 3 here, which was the most important thing to do in the treatment. She decided not to extract the upper eights. I was okay with that. I told her, okay, if you don't want to extract the upper, it's okay for me. You have already extracted the lowers, but actually you have to extract the uppers. Remember, this is what we got. And this is how we finish the treatment. So it was almost 4 millimeters of difference. So here's the smile. Natural teeth, okay? Just natural teeth. Any restoration. Look at the smile here. There's a huge difference. There's a very huge difference.
So, Dr. Hector, it's amazing result.
Thank you. Thank you. Thank you very much.
Can we have a questions now? Because we have like 5 minutes only.
Okay. Okay. Oh. I have another case. If we can see it maybe for like 4 or 5 minutes, is that okay to you?
Okay, no problem. As quickly as possible.
Okay. Okay, let's go with the last case because this one is very, very good. Very good case, okay? I just want you to see this guy. This is Abraham. Abraham decided to go with me because she was sent by the prosthodontics, and the prosthodontics told me, you have 8 months to correct this. Just 8 months. And take a look at this. I was like, okay, if 8 months, if 8 months it's okay to you, I maybe will need another patient because I cannot do this in 8 months. So for me, it was very important to complete all the things that of the objectives that we have to do with this patient. And I told him that maybe we could spend like 2 years of correcting everything if he wanted to correct everything. So we have to correct this crossbite here. I mean, this class tree. So I'm moving fast so you can see the result at the end, okay? There's the trunclination of the upper teeth. And as you may see, we are moving everything backwards like a class tree, but this is in a different case, always with the elastics. This is the way we're trying to correct this class tree. And this open bite and this um, crowding at the lower, okay? So let's take a look how we expand first one of the faces and then we expand symmetrically, okay? So this is what we got after the first part, and this is not still finished yet, but we have to keep going, and we're doing another check, another one, and this is what we got after the second phase. So we decided to do another phase, another more phase, and I told her, man, we just need like maybe 3 or 4 months to complete this. You have to do this. And he told me, I'm okay, I'm going to complete this. We decided to keep going to more additional aligners. And this last phase, we were just trying to correct the settling of the occlusion. And as you may see, we have corrected all the things that we needed in this case. All the crowding, the open bite, the class 3, the midlines, the spaces for the implants here, the crowding in the lower, and let's take a look on the difference between the beginning and the end, just right after 21 months with 7 days aligners change. So this is like magic, because you may see there's a very big difference between the beginning and in the end of the treatment. Look at this change on the class 3. Okay.
Okay, thank you. Thank you for your amazing result and this amazing lecture. I have a lot of questions for you, sir. First one from Dr. Ahmed. He asking how you get back off all the teeth in the lower arch. That I think
In the last
the
case,
sequential distalization. Is
okay.
that like the normal movement of Invisalign, or it's the usual movement of Invisalign in general?
Yes, in this, I think you're speaking about this case.
Yes.
Yes, we usually do sequential distalization when we try to correct a sagittal thing. So in this case, the class 3, we have decided not to extract and not to do surgery. And the only way to do this without these two other chances is distalizing. And this is the way that we do with clear aligners, with Invisalign. So we move teeth by teeth, and we are correcting this class 3 just with elastics.
Yeah, because usually we distalize in the upper arch, not in the lower arch.
Yes, and it's harder to distalize the lower arch, but
Yeah.
it happens too. It happens. It is possible too.
Okay, I have another question. It's from me. How to control a bite during wearing the aligners upper and lower? Because if you see a patient with retainer and a very cooperative patient, you will find a lateral open bite by time. So how during the treatment the patient wearing the upper and lower aligner, and there's a control of the lateral bite?
Okay, that's a very good question. And the way to correct this is one of my tips is you have to put red contacts at the back. You know what I mean? In the clean check, you have to put red contacts in the back so you can fit like harder the occlusal contacts. And if you control the torque, if you control this root inclination at the back, you have to control it. If you're expanding, you will not have this trouble. At the beginning, I used to have this kind of troubles, but now I don't have any more troubles of open bite at the backs or lateral open bites because we control the torque. And this is the most important thing: torque controlling and red occlusal contacts in the clincher.
Yeah, okay. So we have another question. In the last case, how long it takes the first phase of the treatment?
The first phase in the last case,
Yes.
the last case took us, let me tell you, because we did three different phases. Remember for that case. So
Yeah.
the first one was about 43 aligners, but minus six because I used six aligners for different things. The last six aligners for me are three aligners without attachments, and the last three aligners are overcorrection aligners. So it's 43 minus six, it's 37 aligners, which is, if we change weekly, it's about 9 months for the first phase. 9 months, just the first phase. And
Okay, doctor, last question. What's your retention protocol for like the last case of severe crowding? What's the retention protocol?
okay, the retention protocol for me, it's always the same. I always do fixed retainers for both arches, upper and lower, and clear retainers or Essex or Vivera retainers for for all the patients. So I always wear four aligners. If it is a deep bite, we put ramps on the upper with Vivera, and if it is an open bite, we try to tell the patients to keep biting in the back hard so they can maintain the nutrition at the back. So that's our protocol for retention.
Okay, thank you, Dr. Hector, for this amazing lecture. It was very useful one, and I will think of changing my yeah, retention protocol myself for doing this. Thank you for your time and for joining us in our first Delta International Conference. Thank you very much.
Thank you, guys. Let me just say a final thing. Remember that
Okay.
we have our master course here in Mexico. We changed the date because of the coronavirus. So we're going to do it on February 26 and 27 of next year. So if you need information, please call this number. And I also want you to add me to the social media because I want to have a lot of friends from Egypt and from the other side of the
Okay.
world. So please
Thank you.
add me on Facebook and on Instagram. Thank you,
Okay.
guys. Thank you
Thank
for
you very
everything.
much. Thank you very much, Doctor. Thank you.
See you soon. Thank you.
Bye bye.
سامي هيتا سامي شعرك سامي عمل ماسك الفات سامي
So we will have Dr. Herrera in 10 minutes for his lecture. We will take like 10 minutes break and come back.